Meeting will start in about 4 minutes. The meeting will start in about 3 minutes. The meeting will start in about 2 minutes. All right, Tracy, I have 2 o'clock.
All right. I want to say good afternoon and thank you all for joining us today for our weekly or bi-weekly update of COVID-19. And Sean, I think we have been doing this for almost a year, haven't we?
Well, we had we started doing this pretty early on. I can't remember. Yeah, close to a year.
Yes. So, wow. Um, Anyhow, we have members of the executive team who's going to be answering questions that you all have submitted regarding COVID over the last couple of weeks. And then I think Sean is going to share just some additional information with us. But first, do you want to give us some updates, Sean, from the past 2 weeks?
All right. As of last night, we have, as of last night, a total of 1,663 cases in Adair, with 42 of those being currently active. 1,267 cases total in Casey, with 15 of those currently being active. 1,383 total cases in Clinton, with 13 of those currently active. 652 total cases in Cumberland, with 14 of those currently active. 1,104 cases in green, with 24 of those currently active. 1,748 total cases in Macquarie, with 25 of those currently active. 5,723 cases in Pulaski, with 110 of those currently active. 1,732 total cases in, Russell, with 58 of those currently active. 2,728 total cases in Taylor, with 66 currently active. 2,067 total cases in Wayne, with 26 of those being active, for a district total of 20,067 cases total, with 393 currently active. Of those 393, we have 42 that are presently reported as in the hospital, with the remaining 351 on home isolation. We've had a total of 352 deaths in our district. So we know that our death rate or mortality rate is 1.75% of known cases, which is about 1 in every 57 people who get it. And our hospitalization rate is about 5.52%, which is about 1 in 18 people who get it. Of particular importance, as we're thinking about vaccination efforts, as we think about the mortality and the hospitalization numbers, we know that of those who are 70 and older, I'm trying to get to that chart on my page here. Give me a moment. Of those 70 and older, it's almost 75% of our deaths. And if we go to 60 and older, that's 90 to 91% of our deaths. So I know there's a lot of questions right now. Why are we focusing so much on that 70 and older and then moving to the 60 and older? Because that represents most of our deaths. As far as hospitalizations, 70 and older is a little more than half of our hospitalizations, and 60 and older is almost 75% of our hospitalizations. If we had an unlimited supply of vaccine, of course, we would just make it open to everyone, but the vaccine still is limited, and we want to target it first to our most vulnerable populations. And I know people will say, well, there's other individuals who are vulnerable other than the 60 and older, like folks with compromised health conditions. But, you know, to keep it as simple as we can, doing the 70 and older and 60 and older makes that screening process very easy. Plus, a lot of people with compromised health conditions are in the 60 and older age group. So, you know, we want to try to move through those. Our incidence rate is going up this week compared to last week. That's no surprise. With the blizzard last week, not a whole lot of people was getting out and getting tested. So I don't think that it's a real reflection of what's happening with our cases comparing this week to last week. It'll probably be into next week before we really know what we're doing locally. At the global level, at the national level, at the state level, things seem to be trending down at every level. So I would assume that's what's going to continue with our district. So I think that's all I'll do as far as opening comments, Tracy.
Okay, Dr. Wayman, do you have anything you want to share yet? Oh, okay. I do want to remind you all that you can put questions in the chat box, and we will be watching that throughout the rest of the meeting today. So, first question, and I think this is for you, Sean. When do we think childcare workers will be offered the vaccine? Soon, later?
Well, according to the governor and the folks in the State Operations Center, childcare workers are now have been defined as being included, I think, in Group 1B. So they're eligible as soon as they can find a provider that has open slots, and they're welcome to schedule an appointment now. Anyone in Phase 1A or 1B can schedule appointments now. 1B includes those 70 and older. 1A includes healthcare workers and nursing home. Of course, the nursing home, personal care homes are being taken care of by that federal contract with CVS and Walgreens. And then the 1B is first responders, Healthcare workers were in 1A. Teachers have pretty much been taken care of. If there was any that missed an opportunity, they can still schedule right now on the 70 and older. And of course, and one other group that we've told can schedule appointments is any members of the clergy who actually go into the hospital to perform end of life care or end of life work with families. They're eligible to schedule for a vaccine too. So, but daycare workers can schedule now. Now, you're not a daycare worker if you're taking care of your own children. You're a daycare worker if you have a licensed facility and are servicing children in a licensed facility. Tracy, you're more familiar with the daycares than me. Is that an appropriate way to define that?
Yes, sir, it is.
All right.
Yes. Okay, next question is for you, Dr. Wayman. Have you seen many cases where a person who has had the first COVID vaccine has actually become a positive COVID case? And then also maybe after they've had the second vaccine too?
Okay, so we do not monitor.
I can't hear you, Dr. Wayman.
You're a little low. You might want to come in closer.
Okay, so we as a health department or district do not monitor.
We're still having trouble hearing you, Dr. Wayman.
I don't know what to do. Can you hear me now? Can you hear me now? I'm not muted.
No, let's see. Tracy, why don't you let Stuart answer the next question, and I'll see if I can go help Dr. Wayman with the.
Okay, I will. Stuart, this one's for you, okay? How do you think the new announcement regarding this new announced school guidelines will impact COVID across their district?
So Kentucky.
You have to turn your volume up too, Stuart.
Oh, okay.
You're not dialed in, are you? Or are you?
No, I just don't. Why don't I just
Oh, can you hear me?
I can, yes.
Okay. As far as the new school guidance goes, Kentucky's still operating under their the guidance that was put out about mid-December. I know CDC said some other things, but if you're in the orange zone, you should be doing a hybrid model. If you are a red county, you should be aggressively doing a hybrid model. Nothing changes as far as masking or social distancing. So those things are still in full effect. Children still have to mask at school, and teachers, and social distancing still has to be used. So, not a whole lot has changed, except for we do have the teachers that have been vaccinated now, which is a good thing. And hopefully that will help with spread among those teachers who of course are a little bit older. We know that it doesn't affect children nearly as bad, and sometimes not nearly at all. But all the quarantines are still in place if COVID is in a classroom. The one thing that we would like for people not to do is become complacent, because it can still spread among the children in the school, and those children can still bring it home to their parents and grandparents who haven't been vaccinated yet. So we don't want anybody to be complacent, not in the schools or not in churches or in any type of gathering situation.
Stuart, do you hear us any better?
Yes.
Yes.
A lot better?
Yes.
A lot better.
All right, I'll switch back out.
Okay. Thank you, Stuart.
All right.
So just to reiterate that, Dr. Wayman, it's talking about if a person has gotten vaccinated and if they become a positive case after the first vaccination and also the second.
Okay, so we as the health department or as a district do not monitor for these, but we do know when we do case investigations who's had a vaccine and who hasn't. So we have seen a handful, maybe 3 or 4 cases of people having COVID after the first dose, but most of them are within a few days of that dose, which means they're not immunized yet. And we have not seen any who've had 2 doses. And basically, you are considered immune 14 days after the second dose. Both of these vaccines have 95% protective ability. So we know from all the studies that they're excellent. And even 1 dose, it protects about 60 to 70%. So we hope we don't see any after the second dose.
Okay. Thank you, Dr. Wayman.
The state is monitoring that, so we should have some numbers down the road.
I think, Dr. Wayman, with any vaccine, there is an extremely small percent.
Sean, will you speak up just a little bit if you don't care?
I think with any vaccine, there's an extremely small percent that it's ineffective for, but if you're getting 95% of the population, you're doing pretty good. Can you hear me all right?
Yes.
Yes.
All right.
Okay, next question. Will additional sites be added to administer a vaccine across our district?
Well, every Thursday on the governor's brief at 4:00, he announces new sites, and they've been adding new sites every week. I am aware, I can't talk about it. It's embargoed until the governor announces it, but I'm able to be in some of the discussions of things that are in development. And I do know there are additional sites that'll be opening up over the next week and the next week in our district. So that's good. We're just now starting to be able to get some data that shows by county location or by address how much percent of the county's population has been vaccinated. And so we're able to see, like, in Pulaski County, maybe it's 15%, and in Wayne County, maybe it's 8%. And while that information's not fine-tuned yet, we're starting to be able to get some information like that. So with the health department, our supply of vaccine, we're the only facility in the district. We get our 1,000 doses at our district, and then we can divide it up and push it out to the counties. And we will try to push it to the counties where we see there's the least amount of resources, meaning that there's other providers aren't available in that county, or there's not much vaccine going into that county, or if we see places where there's just not been enough uptake. So we'll try to strategically use our allocations to make sure for our 10 counties we're filling the gaps as best we can. That's by the way, one of the reasons why it would be difficult for us to keep waiting lists, because our supply of vaccine is going to be more flexible. Whereas the other providers, they're getting a set amount for their county, for their facility, and that's what they're getting. For us, we can be a little more surgical with our approach.
That's wonderful that we'll be able to see that, Sean. Good. Next question. Do you think we will see another surge of COVID cases in Kentucky and Lake Cumberland, or do you think the cases are declining and will continue to do so?
I think that, we've had a certain percentage of our population who've had this and recovered from it. We're getting more and more people who are being vaccinated. And so that's all good. What we don't want to happen is we don't want to become complacent because the numbers are going down and we're seeing people get vaccinated, and we become complacent to the point that we start letting it ramp up again. So it'll only ramp up if we're not careful. So, what I mean by being careful is the things that we've been talking about for a long time is continue to social distance, continue to mask, avoid crowds when you can, make sure you're sanitizing. I just got off a call with the State Department for Public Health. They were talking about all the projections of vaccines. I mean, it's very promising that by the end of July, the end of August, we may have enough vaccine have flowed into our state that everyone who wants a dose would have had a chance to have gotten it. So I know that seems like an awfully long ways away, but I mean, we're almost to March. So March, April, May, June, July, August. So, 5 or 6 months, if we can all just be patient and this is not going to be forever. There's a lot now. We know July, August, sometime in that time frame, the bulk of this is going to be behind us. So we can be really cautious now for the next few months and keep this thing tamped down, or we can let it run wild for the next few months and let it spike up again. And I just hope we don't do that.
Okay. I have another question. This one is for you, Dr. Wayman. When a person gets the second shot, the COVID vaccine, I heard that younger adults may experience more side effects than older. Is this true? And if so, why?
Yes, it is true. And it's because older adults have weaker immune systems. And the side effects are all due to the immune system being ramped up to produce all the appropriate chemicals to fight the next infection.
Okay. That's all the questions I have. Are there any in the chat box, Sean, that you see?
No, I don't see any. So we've got some people listening in live. You're welcome to type in a question and we'll answer it if we can. Oh, we can make some general comments about the vaccine distribution model. If you will look at our website, I'll try to share my screen here just so that everyone knows where this is at on our website. Let's see. Well, I will get there. All right. So, Tracy, are you seeing our homepage?
Yes, I am now.
Okay. So when you just go into the Lake Cumberland District Health Department homepage, you'll see this COVID-19 banner. First thing you'll see. Now that banner rotates and it may move to something else, but it'll come back around in a second, or you can click one of those little buttons. But when you click that, it takes you to our daily brief. And it's got all the information about all of the statistics for the day, new cases for the day, different things that's happening as far as our case count. But at the bottom, it's got vaccine information. So it's got all the different places in our district where you can get the vaccine. Now you can get this information also off the state's website, Kentucky COVID-19. But I've put it on our website too. Some of our citizens probably follow our site. Some of them probably follow the state site, but we wanted to make sure it was easy to see. You can get to the state site here, but we have the 4 regional hubs right now. We've got how you can get in touch with them. If they have an online scheduling portal, we've got that linked. Some of them are using like a text option. If they're doing that, we've got that link there. Whenever we start scheduling again for our next set of appointments, we'll list that right here. And by the way, that'll probably be on March 1st, next Monday. We got to make some decisions between now and next Monday, how much of our 1,000 doses we're pushing to each county to try to fill the gaps. So that's kind of the deal. One thing I'll say, I just got off a presentation with a vendor. A lot of the complaints we get about our scheduling is that we're able to open up 30 phone lines and 20 operators, but it takes them all day and they have to redial a lot of times. We won't have the system set up by Monday, so Monday will continue to be frustrating as far as that goes. But by the next Monday, if we're scheduling appointments on the 8th, I think we'll be hooked up with a vendor who will be able to take thousands of calls a minute. So you won't get the busy signal. Now, the downside will be if we've got 1,000 doses and they can take 1,000 calls a minute, if 1,000 people call the first minute, they're going to fill up the slots in the first, really quick. But at least you won't get a busy signal and you'll be told whether or not all the slots are full sooner. So we are working on that. And then there's these pharmacy locations and if they've got an online scheduling portal, that's linked, and if they've got phone numbers. And then there's just some other information about other vaccine efforts that's that's gone on. So do look at that. We try to update that when the governor makes his announcements Thursday. We'll try to make note of all that and add that to the site. We may not add it to the site until Thursday or Friday or even Monday while we're verifying. If he announces a certain pharmacy or whatever, we may have them in some of our counties. There may be multiple pharmacies. If it's a chain pharmacy, like in Pulaski, there may be more than one. We'd have to figure out which one it is, or if it's both. Figure out how they're scheduling and all that, and get that posted as soon as we can. But so there's all of that. I lost track of what question I was answering. Was I answering a question?
No, you were just sharing vaccination information.
Okay. So yeah, that's there. And I think the real promising information is, the expectation is that Johnson & Johnson will get their vaccine approved, and with the ramping up of the vaccine with Moderna and Pfizer, and with Johnson & Johnson coming on, that, there's a real good chance, as long as the public will continue to take the vaccine, that we can be largely through this by August. It seems difficult to believe, but we're not, sometime between now and then, there'll be more vaccine than there is demand, and we'll be begging people to take it. So, we certainly want people to take it as soon as you can get it, as soon as your phase opens up, and as soon as you get it. We don't want to give this virus a chance to mutate to the point that the vaccine's ineffective. So we need to stamp it out now before it does that. Dr. Wayman, you might want to talk about that. I mean, that's way closer to your expertise than mine. Do you want to say something about that?
Well, I can. Viruses mutate, and of course they mutate because they replicate. So the more they replicate, the more likely they're to mutate. And how do they replicate? By infecting us. So if they can't infect us, they don't replicate and then don't mutate. Mutations are basically errors in their replication. So it's like the old typist in the old days had to constantly clean up the mess because they made a mistake, whereas the viruses cannot. Or sometimes that's a useful thing, that they can mutate, because it could be a beneficial error.
Yeah, they could become less effective.
That
and
too.
then again, they could become more effective. And that's what it's really important over the next few months. Try not to catch this disease. If you're not vaccinated, make sure you're observing the guidance. Of course, everyone needs to observe the guidance until July or August anyway, or whenever the CDC tells us to stop. But my point is, if we can just be vigilant for a few more months, and maybe even more vigilant than we have been, maybe we can get through this. I know there's this, everyone's anxious to get back to as close to normal as they can. We just don't want to rush in here at the end, when the light's at the end of the tunnel, and mess this up and get it spreading again, and let the thing mutate to the point where the vaccine's not effective and we're just kind of back in this again. So let's all work together to get through this. One thing I was going to say is, every day when we post our information on social media, we live in a world where people on social media have forgotten how to be courteous, and there's always a lot of negative things said, and a lot of people post, I don't know if a lot's the right word, but people post nasty things about how it could be handled so much better. If you guys knew how many times that special groups are reaching out to us wanting to get in front of the 60-year-olds and the 70-year-olds, and how many of these groups are reaching out to politicians, and those politicians are reaching out to us. If you knew how much this was happening and how much we're having to get beat up so that we can keep the focus on the 70-year-olds and then the 60-year-olds, which is where we know we're going to get the biggest return. If you knew that, you might be a little easier on us, because we're working really hard to keep the focus on our most vulnerable population. And, we know that if it's 60 and older, that's right at 90% of our deaths, 91% of our deaths, 75% of our hospitalizations. We can make a world of difference over the next few weeks by keeping our focus laser focused on that group, and then opening it up broader after that. It bothers me, I have to admit, that folks that are in that group that are, if you catch it, you're going to be part of the 10% that could pass away. How that, there's certain people in that group that wants to push themselves ahead of the group that's, the 90% group. And so we want to stay focused on where we're going to get the most return for our investment of time. But if everyone can be patient, by July or August, we can be through most of this. So stick with us.
And like you said, Sean, a mutated virus, if you think that if it mutates the wrong way, if you think that it's been rough over the past year, that will be nothing compared to what a mutated virus could put us through. So,
well, it could definitely be much worse.
Yeah.
This didn't turn out to be as deadly as it looked like it was going to be when the thing first came out and was it came out in China, it came out in Italy, and the death rate in Italy was so high. And I still don't understand why the death rate in Italy was so high. Dr. Wayman might have read some research, but I mean, early on it looked really, really scary. So it's no surprise the world reacted the way it did, and it's still, I mean, in I don't know how many deaths have we reached now at the world and at the national level. I think 2. Well, I'll pull that up. Dr. Wayman, did you do any research on the?
Why in Italy there was such a high death rate?
In Italy at the beginning?
Well, first of all, it's because they were really early on in the picture, and so nobody knew anything about how to treat them. But also they apparently have a very high percentage of older people. They have a very low birth rate. So that may be certainly one of the reasons.
Yeah. So if it was killing, the 40 and 50-year-olds at the same rate it was killing the 60 and older, well, we'd be in a much different situation right now. So at the world level right now, we're getting really close to 2.5 million deaths. Last night when I updated this, it was 2.479. By today, it may be 2.5 million when I update it later this evening. And in the United States, we just passed 500,000. So 500,000 deaths in the United States. That was when I updated this last night. I'm sure it's higher than that now. And in Kentucky, when I updated this last night, it was 4,476 deaths and 352 in our district. So, it's a substantial number of deaths.
in the last 14 days, from February 10th to the 23rd, Kentucky has still seen 17,985 cases.
Yeah. So even though the growth rate has really slowed down, there was early on, we were seeing our cases double every few days, but we had so few cases, people didn't notice it. Now our cases, I think, are doubling every 200 and something days, but our total cases. But when you've had 20,000 total cases, that's still hundreds of cases a day, even though it's taking 200 days to double. So, the larger the total volume of cases when you're looking at the growth rate, it makes a difference when you're calculating that. I'm trying to see if I've got anything else here that is interesting. Let me pull up one more file here. And again, if anyone's got a question, anyone that's listening in live, this is the time to put it in as we're winding down. I was opening up one more file here, just a moment. Okay, so district-wide, as of last night, our cases are doubling every 225 days. And our 7-day average incidence rate is 29 new cases on average per day per 100,000. Our highest was 103 cases per day per 100,000, and that was January 8th. And that does not seem that long ago. So we've had a really good and a very welcome decline in the last few weeks. So again, we just don't want to see the positive momentum lost. So continue to follow the guidance. Let me see if there's any questions in the chat.
While you're checking that, Sean, let me say spring break is upcoming, especially for college here in the next 3 weeks or so. And please, if you're a parent and your child's going down to Florida for college spring break, please try and get them as best you can to follow this guidance. If you're going to be taking your kids and at spring break in April somewhere, be sure and follow the guidance because spring break could be our next super spreader event.
The last big spike we saw was Christmas.
Yeah.
And
Are there guidelines regarding travel currently?
I think on the state website, you still have to quarantine if you leave the state and come back. It's recommended.
Yeah. Yes.
Well,
Okay. I just wondered.
Yeah. Tracy, I don't see any questions at all. I think we've covered everything
Okay.
that we have. I encourage people to get your flu shots, follow our daily brief. We post it on our website each night underneath that banner, and we share it on our social media. So, please read that. We'll add vaccine sites and vaccine information as quick as we have it. And we'll give you updated case information, each day. So I'm hopeful that everyone will really take the vaccine as quick as we can get it. And by August, we'll have this behind us and we can go back to, doing normal health department stuff.
True. Thank you all for joining us. We'll see you in a couple of weeks.